Hi, everyone. Thank you all for joining us on a new session of GESI Cochrane Learning Live webinar series. My name is Nadia Name. I'm a research assistant with GESI Secretariat. Just to remind you, or in case you are joining us for the first time, if you have a question, please use the tab on your right to enter your question. And if you would like to give us a comment or tell us about your own experience, please use your raise your hand button so that we unmute you. Cochrane context with Professor Jane Noyes. Professor Jane Noyes is a lead convener at Cochrane Qualitative and Implementation Methods Group. Professor Jane Noyes is an experienced methodologist and health services researcher. She specializes in complex interventions and evaluations and systematic review methods development and testing. Thank you, Professor Jane Noyes, for joining us today.
Okay, thank you very much for that very warm introduction. So I'm just going to check with Dario. Can you see my screen okay?
Yes, that's fine.
Okay, and it's the right screen?
Yes.
Brilliant, thank you very much. So welcome everybody to this webinar. It's going to be on undertaking a qualitative evidence synthesis to support decision making in a Cochrane context. This webinar has been completely oversubscribed and there's been a waiting list, which is a really good indication of the interest that there is in this topic. I only know of one person personally on the attendance list, and that's Karen Daniels at the South African Cochrane Centre. So hello, Karen, I hope that you're on board. And welcome everybody else whom I think that you are new to me. So I look forward to getting to know you a little bit better. So let's crack on. I'm required to give a conflict of interest statement because I work with Cochrane, so I'm not really conflicted, but I do actually have a vested interest in developing some of the tools that I'm going to talk about, but it's not a financial interest. So we're going to start this webinar with a poll. It'll be very helpful for me to know whether you've got no experience, some experience, or lots of experience of undertaking a qualitative evidence synthesis. So you'll see on the screen that the poll is open. If you open up the poll and if you can actually vote A, B, or C. So A, if you've got no experience, B, if you've got some experience, and C, if you've got lots of experience. Now, I know that some of you are in groups and that you've all joined together, so you'll have to have a consensus approach just to help me. So maybe if you vary between no experience and lots of experience, then just sort of tell me that you've got some experience, then I'll know. So Dario is going to manage the poll, and then we will actually just have a little look once the poll is done. So Dario, how long are we going to be?
It's actually the results on your screen. Can you see it? It's no experience.
Okay, I've got it. That's really good. So 35% of you have got no experience, 60% of you have got some experience, and 5% have got lots of experience. So that's absolutely great. So thank you for that. That gives me a little bit of help knowing where to pitch. So as some of you have got no experience, I'm going to start off by just going through a couple of slides that are going to get everybody onto the sort of same place with qualitative evidence synthesis. So to start with, I think that what I'm doing is summarizing what we've published in a series of 7 papers outlining this new Cochrane guidance in the Journal of Clinical Epidemiology. And I've put the link there in the box on the slide. So there are 7 papers there which go into a lot more detail of what I'm talking about today. So do go and have a look at them. I think that they are free to download up until about the 19th of June. So you've got a couple of days to get in and get the papers. The second thing is that this is looking at a part of a global health initiative, this webinar. The World Health Organization is about to publish in the next few months a series in BMJ Global Health on systematic review methods for complex interventions implemented in complex health systems, particularly public health interventions. So some of you might be particularly interested in that guidance as well. So there's a lot of background material to support this webinar, which I hope that you will read. So let's start with a very basic question of what is qualitative research. Obviously, if you're a statistician, then you might actually talk about doing a qualitative synthesis too when a meta-analysis isn't possible. That's nothing to do with qualitative research, so move that to one side. What we're talking about is using a qualitative methodology and methods of qualitative data collection and analysis, and that would be things like focus groups, interviews, and observations that would produce narrative data, narrative findings that can be analysed. And I've put on the side here just a screenshot of the type of study that we're talking about, which would be the experiences and preparedness of family carers for best interest decision making of a relative living with advanced dementia, a qualitative study. So we're particularly talking about synthesizing this type of evidence. So what type of questions can qualitative research address? Well, for many of you, you'll know this. For those of you who've got no experience, particularly the decision makers want to know about patient experiences of living with a disease or a condition, patient experiences of living in a specific context with the disease or the condition. If there's an intervention, then experiences of the intervention, and then also carers' experiences, and then the other key stakeholders such as healthcare professionals, etc. You can also use qualitative research to develop a new theory about something, for example, how something works or why people engage, a theory about the stigmatization of healthcare, etc. So there's a lot of uses which are very exciting of qualitative research that have been underrepresented in decision making to date. So the types of findings from qualitative research that you'd actually take to synthesize would be the description of a phenomenon. That might be a new word to you. So the phenomenon of interest is the issue of interest. So it might be women's perceptions of antenatal care would be your phenomenon of interest. The finding might define a new concept. You might create a new typology around something. You might be describing processes, which would be very important for implementation of an intervention. You might come up with explanations or theories, or you might come up with the development of strategies. So these are the sorts of findings that you could actually be working with. What do they look like? Well, lots of findings, qualitative findings, are presented as text, and that could be quotes, the author's analysis, or it could be tables with classifications and summaries of themes. You could have a conceptual figure or diagram, which is a finding. You could also have images or photographs or artwork. So there's a whole range of material that would actually count as findings that you might be able to synthesize. So that leads nicely into Cochrane. The Cochrane collaboration, you can see at the top here, the logo is trusted evidence informs decisions and better health. Mainly Cochrane is about the synthesis of the effects of interventions in quantitative systematic reviews. But there are circumstances in which you can add a qualitative evidence synthesis for a specific purpose. And that would be to better understand intervention heterogeneity, acceptability, feasibility, dose, reach, implementation, etc. But increasingly, we can also use qualitative evidence syntheses to better understand implementation of complex health system level interventions, such as public health interventions. And then we might actually look at things like feedback loops. So what happens when you implement an intervention in a health system? What are all the different responses in the different parts of the system, and how does the feedback loop around the system, and what happens? And how does the health system adapt in response to an intervention being implemented? So we can look at all those things. But a qualitative evidence synthesis may also be undertaken to formulate the patient-centered questions to look at upfront in a quantitative systematic review. And you also might use qualitative evidence to identify and understand patient outcomes of interest when designing an intervention review. And I'll show you some examples of that later. So the current Cochrane model is that you can undertake a qualitative evidence synthesis that may be developed as using a separate protocol, and then subsequently qualitative evidence synthesis would be integrated with the linked intervention effect review, which would be on the same intervention. So you can see here, there's two examples here. You've got barriers and facilitators to the implementation of lay health worker programs. That's the qualitative evidence synthesis. That was undertaken with a standalone protocol. And then that was subsequently integrated. The findings were integrated with the quantitative intervention review, which was on lay health workers. So the same intervention, but the effects and the outcomes of the interventions were actually explored and explained with the qualitative synthesis, but with two different protocols. Increasingly, we're seeing qualitative evidence syntheses being undertaken as part of a mixed method protocol that includes conducting the intervention review. And you'll see there's an example there of exercise interventions for patients with hip or knee or hip and knee osteoarthritis. So that's a single protocol, and within that single protocol, the qualitative evidence synthesis will be undertaken alongside the quantitative intervention effect review. And there'll be opportunities for the two reviews to speak to each other as the two reviews are carried out. So there are, opportunities to reflect early on what the qualitative evidence might be saying, to then explore in more depth in the quantitative review, etc., and vice versa. So the two reviews can speak to each other. So those are the two models in Cochrane. Outside of Cochrane, you can be more flexible. We in Cochrane are particularly looking at providing synthesized evidence in a decision-making context. But outside of Cochrane, you can do many standalone qualitative evidence syntheses that don't have to link with an intervention effect review. So this next slide, I thought that I would show you. Some of you will be very familiar with guideline panels and decision-making processes. And some of you may not be aware that there's a sort of a documentation that you use. This is an example of the DECIDE framework into which the quantitative and qualitative evidence is fed in order for the guideline panel to make a decision. So quite a few systematic reviews on a topic will be commissioned. And what you're looking at specifically with the qualitative evidence synthesis is to address, in a decision-making context, particular questions around acceptability. And you can see the sections of the DECIDE framework that I've picked out here is around acceptability, and is the intervention acceptable to key stakeholders? Is the intervention feasible to implement? And there's a sort of a decision-making process all the way through. Other sections include things like values. How do people value the intervention? And what are the perceptions about the benefits and harms of the intervention? And these sections of the DECIDE frameworks are the sections that need a synthesis of qualitative evidence, and the findings of the syntheses are presented to the guideline panels, who then draw on that evidence to actually populate the DECIDE frameworks. And guideline panels have had less experience of dealing with qualitative evidence syntheses, so it's our job as qualitative evidence reviewers to make sure that we present the evidence to the panel in the most coherent and the best understandable way. So here is an example, and I'm sorry that this is a bit heavy, it's a busy slide, but this is an example from a NICE guideline. Now, NICE is the National Institute for Health and Care Excellence, and it's our guideline producer in the United Kingdom. And this is a guideline on the long-term management of stroke. And it outlines quite nicely that evidence from qualitative and quantitative studies were used in particular parts of the guideline. So if we just look at the first bit, it says evidence from qualitative and quantitative studies, section 2, 6.2.1. It talks about the inhibitory factors such as limited time, presiding professional routines, and the single opportunity to meet clinicians. And then it talks about secondary risk management. So there were 3 qualitative studies with low to moderate confidence in the studies that contributed to that finding. And then the second bit, which is about standard goal setting in stroke management, and a standard goal setting meeting, which was held away from the patient and with standard documentation. That finding came from the quantitative study, which had low to moderate confidence. And those, the sort of combination of the quantitative and qualitative then was added with 5, I think there were qualitative studies. And then that was, the evidence was translated into the clinical guideline, and the actual evidence from the clinical guideline and what the clinical guideline said is posted at the bottom of the slide. So that's how important the qualitative evidence is in understanding the big picture. Otherwise, guideline producers has just got the evidence of effect. They haven't got the patient perspectives, they haven't got how to implement it, they haven't got how to actually explain different types of effects or heterogeneity in effects, or why the intervention works with in some settings and with some people but not in others. So moving on to the question, you will all be aware that in a systematic review context, your question is the most important thing. And with a qualitative evidence synthesis, you start off with 2 positions. Is your question fixed or is it negotiable? And if it's fixed, it's often fixed because it's fixed to the PICO, the Population Intervention Comparison or Outcome Question Formulation Framework, because it's attached to an effect review. We often, with a qualitative evidence synthesis, add on a SPICE question formulation framework because it's a bit more conducive to thinking about the setting, etc., and the qualitative side of things. And SPICE is setting, perspective, phenomenon of interest, the thing that you're interested in, comparison, and evaluation. So the fixed questions, such as what factors affect implementation of intervention X, act as anchors. So they anchor you down, all right? So that's very much what we do in Cochrane. If the question is negotiable and it can be explored as part of the review process, then the question can act as a compass. It can show you the direction that you can go. And it might actually be then about how you refine questions into a systematic review later. So for example, a compass question would be, what do women conceptualize as good antenatal care? And then how women conceptualize antenatal care then actually goes into the quantitative intervention effect review. And colleagues have just done this particular review, and I've got the reference for you at the end. So there's 2 completely different types of questions that you might want to address with a qualitative evidence synthesis. So in the qualitative and implementation methods group in Cochrane, we recommend 3 methods of qualitative evidence synthesis, and I'm going to show you some worked examples of each. We recommend framework synthesis, thematic synthesis, and meta-ethnography. The reason why we recommend those these 3 methods is because we've selected methods in which that you can use the findings in a specific way, and I'll explain what I mean by that in a few seconds. So I'm just going to ask you to use the chat to let me know if you've used any of those methods. Just pop in the chat, yes, you've used framework synthesis, or you've used all 3 of them, or you haven't used any of them. Now, unfortunately, the whole audience can't see the questions or the chat, but it'll give me an idea as to what you've done, and it will actually give me a bit of an idea of how to sort of frame sort of questions at the end when you ask me them. So just pop anything in the chat that you'd like to. So the reason why we've chosen framework synthesis, thematic synthesis, and meta-ethnography is it allows you to do something called transforming the primary data in the primary studies. And to explain this for those of you who've got no experience of a qualitative evidence synthesis, you need to understand how findings are constructed. And so the way that we actually sort of classify findings is we call first order constructs as being quotes from the participants in the primary study. So a quote that you will see from somebody, a participant in the study, is a first order construct. When those quotes are actually grouped together and coded and developed into a theme, and they've been interpreted by the primary study researchers, they're called second order constructs. Now, In a Cochrane context, we want to go to a third order construct, which is we want to come up with new synthesized findings and hypotheses, which are developed by the review team, or the review authors, that move beyond the interpretations in the primary studies. And in order to do that, we need to not only translate the findings from the primary studies one into the other, and then you come up with a summary of findings across the studies. What we need to do is move beyond that, and we need to transform those findings into new understandings of the phenomenon that we are particularly interested in. So we have chosen 3 methods in which you can transform the findings to come up with a more nuanced understanding. So that's why we have chosen framework synthesis, thematic synthesis, and meta-ethnography. Okay, but there are other methods. There's probably about 40 or 50 different methods that you could use, but we've particularly chosen these methods for a decision-making context. So if you don't know where to start, and I'd say 75% of you on the webinar have got some or no experience, we've written some guidance, and the reference to it is here. And we've come up with the retreat framework of things to work through, such as your research question, the epistemology or the theoretical and philosophical underpinning of where your research question comes from, the time and time frame, the resources, the expertise, the audience and purpose and type of data. So you have to work through all of these things, and it helps you when deciding what method that you're going to use. So if you're not doing this review in a Cochrane context, and you can use any of the sort of 30-odd methods, then we've given you a decision-making framework that you can go through in order to make a decision. There is a guide that you can download from the web, which is free to download, or there is an article in the Journal of Clinical Epidemiology that summarizes as well. So please do have a look at that. So I think the bad reasons for choosing a method are the frequency and use of the method, such as meta-ethnography, so everybody else is using it, so I should. The popularity or sexiness of the method, such as realist synthesis, it's quite new, so I should probably use it without perhaps even understanding it. It's what a friend or a colleague or a mentor has once used, or other people have had bad experiences. So I think you need a proper framework for choosing your methods. And I hope that in giving you this guidance, we've given you a more systematic approach for choosing the right method. The next question is when you should select your review method or design. And I think if you are used to doing quantitative reviews, you'll be used to identifying an a priori protocol which outlines your method. With a qualitative evidence synthesis, it's not that easy, and it does help if you have knowledge of the type, the quality, and the richness of available qualitative studies before you choose your method. And the Social Care Institute for Excellence in the UK have produced guidance on how to do a systematic map. So you actually do a systematic search, you map the available studies to start with, you find out what's out there, and then you choose your methodology. And that, if you've got the time, that's a very good way of doing it. If not, be flexible in your protocol. Say that you'll make a final decision on your methodology once you know what data you're working with. So I mentioned just there that one of the key things to think about when selecting your methodology is how rich or thick your data is. So qualitative data from so-called thin studies will not sustain the more interpretive and transformational approaches, and they're much more limited. Studies that are very thin, such as often many clinical qualitative studies are quite thin, limit you to do the sort of aggregation type approaches where you just sum the findings from the studies rather than interpret and translate the studies and transform. The thick and rich studies are much easier to sustain something like a meta-ethnography. In reality, when you're searching, it's never one or the other. You tend to get a mixture of thick and thin studies, and you know that's quite helpful when doing a thematic synthesis or framework synthesis type approach, which can cope with both. Now, to clarify how thick or thin are findings and where do you find the findings in qualitative research, Most people would think that the findings are in the findings section, but they're often not. So here is a typical study with a findings section, and in qualitative research you report findings rather than results. This is a screenshot from what I would call a study with rich description, and I'll sort of explain why. So you've clearly got your findings. There's a nice statement of the findings. So there's an overarching high-level finding here it says the overarching or core theme that emerged was to capture. Then underneath it, it goes into a really nice explanation of why that theme was so. There are then sub-themes that are explained, which I've circled in yellow. There are quotes that illustrate the themes, as you can see here. And then there are explanations under the themes of the primary researcher's interpretation of what's going on, as in here. So the first order interpretations are the quotes and how people make sense of their own experience. And the second order interpretations are how the primary researchers have interpreted those. So this is a really nice example of a rich, conceptually rich study. And these are the sorts of studies which are ideal to do a synthesis with. The thinner studies don't have this level of detail. They're very thin on detail, hence they're called thin. Okay, so you can't help with your question what you're going to end up with, but you do need, or it is helpful to have a mixture of rich, conceptually rich studies and those that are not so conceptually rich. Often you have to make decisions about, you know, do you try for a geographical spread of studies, and do you sacrifice the sort of thickness of the studies to make sure that you capture other things of importance, such as you've captured different populations and things. But that's for another webinar. We can do a whole webinar on selecting studies for synthesis. Also, you might find that a certain theory has been associated with the study, which makes it nice and rich. So here in the findings here, it talks about stigma. And as many of you will know, there's an existing theory of stigma by Goffman. It's a well-developed theory about how to identify and look at the acceptability about stigma and how it's socially managed and constrained. So this particular study also used a theory, and that actually added to the conceptual and theoretical richness of the study and the findings that you could then extract. So sometimes important findings aren't in the findings section at all. So this particular piece of information was found between the introduction and methodology sections. And at the bottom here, it says we applied a social determinants of health perspective in the third level of data analysis to help organize the themes and the sub-themes that emerge from the inductive open first level and focused second level coding. So there's more information there about the richness. So I think the key message is that findings can be virtually anywhere in the paper. Don't just look in the findings section. So if you are starting off, here are some safe options. So if there's a pre-existing theory or framework, then select framework synthesis, and then its offshoot of that is best fit framework synthesis, and I'm going to go through what that is in a minute. If there's a proximate or closest theory or framework, then you can use best fit framework synthesis, where you create a composite framework. If there's no theory or framework, then go for thematic synthesis. If you want to develop a theory, then go for meta-ethnography. So that's your decision making. And it depends on the level of theory and the richness of the studies. And as I said before, to do a meta-ethnography, you do need conceptually rich studies. So in your decision making in a Cochrane context, that's what we would suggest that you go through. If you're unsure about selecting a social theory, and we've written some guidance in Cochrane and published it in the Journal of Clinical Epidemiology, which gives you some guidance on how to choose a theory and the attributes that you might be looking for in a theory. And that might be a psychological theory, such as the theory of planned behavior. It might be actually a theory, for example, a sort of conceptual framework of how you implement something in practice. So we've provided a guide. Again, this guide is free to download through Cochrane, or you can go and get it through the article in the Journal of Clinical Epidemiology. So finally, on to framework synthesis. Some of you will have experience of this before. You've given me a little bit of indication who has used framework synthesis before. So it's got 5 stages. So you've done your search on your topic, you've got your framework synthesis question, you've done your search, and you've sort of got to the stage where you've got your included studies in front of you. And again, we could do a whole webinar on those stages alone. So I'm assuming that you've got your sample of studies in front of you. And the 5 stages are as follows. So you familiarize yourself with the included studies, and that basically means that you've got to read them and reread them and understand those studies. You familiarize themselves. The next stage is to identify or to develop a thematic framework. So hence it's called framework synthesis. And you can either do that by actually using the question and using the policies that inform that question, and by reading and rereading the first few studies to create a framework of things that you're particularly interested in looking at. And I'll show you an example of that in a minute. Or you can use a framework such as an existing theory. And I'm going to show you some examples of those in a minute. So you then index, and that means that you apply the framework to code the individual studies. So you either extract information in the primary studies that can be mapped against the elements in your framework or your elements in your codes that you're looking at, and I'll show you. So you do that on an individual study basis. So you apply the framework to your study, you extract all the information out, all the findings out that help you address those particular areas. And then from that, you distill, you start adding one study to another. So all the information around one code across the studies, you'd actually pool together to get a sort of an overarching picture. And then you'd start developing themes around the findings that around the particular things that you're looking at. And from that, you create charts which contain distilled summaries of the evidence. And then the charts are used to help define the concepts and the nature of the phenomena, to create typologies and the associations between themes as a way of developing explanations. So that all sounds quite a lot, but the best way is to, I think, look at some examples. So this is an example of a framework that was used in a National Institute for Health and Clinical Excellence guideline production, which was around tobacco harm reduction. So this was a framework that was created around existing policies around tobacco harm reduction, particular things of interest that we were looking at. So you'll see here that we were looking at the type of intervention, we coded for that, the selection method, whether it was self-initiated, whose voice was speaking, we coded for that. We coded for whether reduction was successful, whether they're a quitter, whether they're unsuccessful. So we had the question in mind, and we linked this with an intervention review. So we were already aware of all the things that we wanted to look for. We wanted to look particularly for equity issues in young people, whether they were disadvantaged, whether they were adult, etc. So we coded for all of that. And then we created a framework of codes which included themes and sub-themes. And these included things like the perceived barriers and facilitators against smoking, smokers in homes and environment. And we extracted the evidence out on that. We were particularly looking to populate evidence against social barriers, social facilitators, physical barriers, physical facilitators, and so on. So this is part of the framework. It goes on, but you sort of get the idea. We created this particularly for this particular systematic review, against which we extracted the evidence to build up a big picture across the studies as to what was successful with tobacco harm reduction interventions. So that's one example where you make the framework for your particular review. Another example is where you use an existing framework. So this is from a Cochrane review. It's the lay health worker review, and it used the SURE framework. Now, I have no idea what SURE stands for, but it's a theory-informed framework that looks at the factors, implementation factors, when implementing a new policy. So you'll see here, it's quite intuitive. It's on different levels. So it starts off with the recipients of care, and the factors that affect implementation are the knowledge and skills, their attitudes towards program acceptability, their motivation to change or adopt a new behaviour, and so on. So we then took these particular things and we mapped those against the primary studies that were included in the review, and we extracted out all the information that would help us address these issues and understand them. We had to adapt this framework a little bit because we found out that it was a bit too constrained, and that's one of the things about framework synthesis, is that your framework can be too constraining, and you might have to adapt it just a little bit. So there's an example of the SURE framework. This is another example for those of you who like theory. This is a framework that uses something called normalization process theory, which is another implementation theory, which is about staff behaviors, professional behaviors in implementing an intervention. So again, it's got all the particular factors around staff and implementation here. And then again, the evidence is picked out from the individual studies to populate it. So again, a different type of theory. And again, go back to our guidance on how to pick a theory to make sure that you've got the most appropriate one. So there are several examples of framework synthesis in the Cochrane library that you can have a look at. Here's just one of them, and I suggest you go and download it. This is the barriers and facilitators to the implementation of lay health workers programs to improve access to maternal and child health, and that used the SURE framework. So I'm just going to ask you here to use your chat. Can you share any of your thoughts on framework synthesis? I mean, would you use it? Have you used it? What do you think of it? I think from my perspective, it's a really good first step. It's probably one of the most common forms of synthesis. It allows you to get started, but the choice of the framework is the most important thing. It can be too constraining. And in moving on to look at thematic synthesis, and specifically the thematic synthesis approach developed by Thomas and Harden, they developed this approach because they first tried a framework synthesis and they found it too constraining, so they ditched it. And they came up with this new approach, which is a three-stage thematic synthesis approach, which includes, and many of you who are primary qualitative researchers will understand this, it's very much like a primary method of qualitative analysis. You do line-by-line coding of the primary study, the development of descriptive themes, so it's all inductive. You don't start off with any preconceived ideas or any preconceived framework as in the previous approach, and you develop analytical themes. Now, analytical themes is moving up to the third level, where you're hoping to develop new theory or new theoretical insights. The descriptive themes are describing what's in the primary studies. So there's a lovely paper that James and Angela produced on how to do this. This is around children's healthy eating, a qualitative evidence synthesis. You can see that they've uploaded the whole of the primary study into a software product, and there are lots of software products that you could use to do qualitative evidence synthesis. And here they are doing their stage one line-by-line coding. And you can see that what they're looking for here is children's data around talking about healthy eating, and they've coded everything in the primary studies that is around children talking about healthy eating, and it purely is just coding like that, free coding, creating codes that best describe. So you can see in yellow here they've coded that bad food, nice, good food, awful. They've coded it under the perceptions of health benefits, and they create this typology of codes that actually best helps them understand the data at descriptive level. They then do carry on with their inductive coding, and they can create up develop descriptive themes, which describes the sort of totality of what the primary studies are saying. And then level 3, they can move up above that, and they can do their translation and move to transformation of the data, and do their interpretation of what's going on that's not necessarily reported in the primary studies, but they can hypothesize and develop new theories as to what is going on. And you can see on the right-hand side of your slide that they've come up with 3 recommendations out of that, which is a new interpretation of the primary studies. And you can find the whole reference to this here. Just to have a look at how they've done it, and the original reference to the review is in the Epicenter library, which is free to download. So again, share your chat with me on your thoughts on Thomas and Harden's thematic synthesis. What do you think of it? Could you use it? Does it seem slightly more difficult than framework synthesis? Do you need more skills to do it? I would probably say yes. I think that if you're a novice person, never done it before, then you do need experience in qualitative research. You need that experience of data handling, because there's a vast amount of data here for you to make sense of. So you do need some training and experience of qualitative research to make sense of this. Otherwise, you can get lost in the data. So I'm going to move on finally to meta-ethnography. Meta-ethnography is probably the most complex of qualitative evidence synthesis approaches, and you really do need to have an experienced team doing this. So there is a really nice book on how to do it, but we've moved on quite a lot from the basic descriptions in the 1988 book by Noblit and Hare. But as I said before, meta-ethnography is specifically for developing new theory on something and new theoretical insights. And you'll see here I've put in the quote, it's making a whole into something more than the sum of the parts alone imply. So you do need to be very interpretive, you need a plastic brain, and you need to be very creative, but your creation and the way that you develop theory needs to be embedded in the evidence, all right? And one of the criticisms of meta-ethnography is people that can go a bit too far when developing new theory. So I said it's more complicated. There are 7 stages: getting started, deciding what's relevant to the initial interest, reading the studies, determining how the studies are related, translating the studies into one another, synthesizing the translations, and this is where you start transforming the data and then expressing the synthesis. So I'm going to look at those one by one. So you start off by doing what they call a reciprocal translation, when you look at all the concepts in the primary studies and see what is similar, and I'll show you how to do that. You then go back and look at the studies and say, well, does anything not fit that pattern? Is there an alternative explanation? And that's what they call a refutational translation. And sorry for those of you for whom English isn't your first language. These are big words to deal with, but I'll try and give an explanation of what it means. And then once you've done those first 2 stages, you would do a line of argument synthesis, which is very much like the thematic synthesis that we've just seen. But it's going, again, it's translational, it's going up to the theory level, the development of theory level. So let's look at what the reciprocal translation looks like. So you're looking at the individual studies to see what they're saying and what they're reporting, and whether there are similarities across the different studies. So you can see here in study 1, there's concept X. There's also concept X is reported in study 2, but concept X is not reported in study 3. There are new concepts there, Y and Z. So you're looking to see how the concepts translate across studies. So you actually find a way of organizing all your studies, and just starting off with one, seeing what's in it, then you look at the next study, seeing how that maps on to see whether there are new concepts, whether those concepts are similar in other studies. So you go backwards and forwards, until you've done your reciprocal translation and you've mapped all the findings across all the studies, and to see how they fit and relate together. You then go back and do the refutational translation, and this is looking for evidence that doesn't fit to the evidence that's translated across. And so, for example, in study 1, you might find that chronic pain is life-changing, whereas in study 2, you might find that chronic pain is not life-changing. And in study 3, it might say that chronic pain is imagined. So all of these are at odds in terms of findings. So you also have to map that as well. For those of you who are qualitative researchers, primary qualitative researchers, you might know that as your disconfirming case, where you look for alternative explanations when you're looking at primary qualitative data analysis. Then your line of argument synthesis. You want to create a line of argument or a finding that translates and transforms across those studies. So it might be getting diagnosed, getting treated, and then so on and so on. So you create a coherent story that creates a finding that translates across the studies, and then you present it. So we've talked about here about the first, second and third level constructs, and that's really important for meta-ethnography. So the research participants' experiences are the first order, the researcher interpretations of the second order. In meta-ethnography, you definitely want to get to the third order, which is the new interpretations. This is what this methodology is designed for. So I'm going to whiz through one example, which is a very classic example, is using research about lay meanings. And lay meanings are patients' meanings, people who aren't experts or professionals. So lay meanings of medicines as one example. And the research question for this meta-ethnography were, how do the perceived meanings of medicines affect patients' medicine-taking behaviour and communication with healthcare professionals? So starting off, deciding what's relevant, you do your searches, and there's a lot of them. You have to select the qualitative studies that you think are relevant, and you can purposefully sample. In quantitative reviews, the sort of convention is to include everything. With a meta-ethnography, you couldn't possibly do that, so it is possible to select the studies. And again, the concepts from the individual studies are then translated. Once you've read them, you get an idea of what's similar and different between the studies. And then you look at how the studies are related to each other. And in this particular example, the common concepts across the studies were these. So there was adherence and compliance, self-regulation, aversion, alternative coping strategies, the sanctions, and the selective disclosure were seen across some but not all of the studies. So that's how they worked out when they were translated, and you looked at how they were related. And then thinking about telling that coherent story, the new interpretations from those concepts that I've just inserted on the right-hand side, and then how they related to those new interpretations are shown with the arrows. So you build up this new interpretation by reconfiguring the evidence and having a better understanding of it by putting all the studies together. Now, of course, in many of these qualitative evidence syntheses, you have an expert group. You take your findings to the expert group. Your expert group would include your patients, your consumers, etc. So you would need a big review team to do this, and you would need to make sure that you'd got all the resources in place. So these reviews are expensive. And then this is the final sort of phase, leaping ahead. This is their final theory that they came up as to why people do or don't take their medicines. They came up with a new theory as to why people reject their medicines, take their medicines as prescribed, or become passive acceptors of medicine without question. All informed by the evidence, but it was a completely new interpretation that if you took any one of the individual papers that contributed to the synthesis, you wouldn't find that there. So I've got a couple of examples. This is of a meta-ethnography. So this is one that was done as part of a Cochrane and WHO guideline, What Matters to Women. It's called a systematic scoping review, but actually it's a meta-ethnography. And it was designed to determine what mattered to women about their antenatal experience, and the sorts of evidence that it came up with included their values, the acceptability, equity, feasibility, and something around personal accounts around the benefits and harms to supplement the quantitative data. So there's a reference for you to have a look at it there. There's also a protocol in the Cochrane Library, which is a meta-ethnography, which is the corresponding qualitative evidence synthesis, which is factors that influence the uptake of routine antenatal services by pregnant women, a qualitative evidence synthesis, and that is a meta-ethnography as well, and it's a really nicely described protocol, so have a look. So again, use your chat to share your thoughts on meta-ethnography. My feeling is, and my experience is, it's much more complicated. You do need experience of doing it. You can get lost. You do need an expert group that you can actually go back to and present your findings to. And they are time consuming. So you do need to take these things into consideration. I just briefly wanted to touch on grade CERQUAL, just so that you know that it exists. Many of you will be familiar with grade, so assessing the certainty in quantitative findings. There is an equivalent approach for assessing the confidence of the evidence from reviews of qualitative research. And the website is here, so you can go and have a look. Briefly, the CERT-Qual approach is a combination. The assessment is based on 4 components. So you assess methodological limitations of the primary studies, coherence of the finding, adequacy of the data that contributes to the finding, and the relevance of the primary studies that support the review finding, and you make an overall assessment. So I don't have time to go through CERT-Qual today. You can book into a CERT-Qual webinar via the CERT-Qual website, and there's a series of 7 papers that have just been published in Implementation Science that are all open access that you can have a look at. Finally, I just wanted to say that there is reporting guidance for qualitative evidence syntheses. There's NTREC, which is for more generic reporting of a framework synthesis or a thematic synthesis. And about to be published is the eMERGE guidance, which is specifically for reporting on meta-ethnography. That will be published any day now, but the guidance is available on the eMERGE website there, and you can just have a look. If you just Google search eMERGE Meta-Ethnography reporting guidelines, you'll go to the website, and there's all sorts of training resources there. There are other manuals that you can look at. I've just put a couple of examples here that, there is good guidance that you can go to look at applying these methods in more detail. I'm not going to say anything about integrating the findings of the qualitative evidence synthesis with the quantitative effect review. That's for another day. We could do another webinar on that alone. And I'm just going to say thanks for listening. And I know that Dario is going to ask if there's any questions that I can address. So thank you.
Okay, so thanks, Jane, for this presentation. We still have a couple of more minutes, so if anyone has a particular question on this presentation, please put it in your chat box, and Jane will try to answer it.
And
so
do ask questions, but even if you think they're really, a minor question, please do ask questions.
Okay, great. So I see we have Gladys who raised her hand. Maybe we should see Gladys would like to ask her question directly to Jane. Gladys, are you with us?
Yes, I am. Hi.
Hello.
I just sent my my question. I just shared my question.
Yeah, would you like to ask it directly to Jane?
Yeah, sure, I'll do that. So thank you so much for this informative session, and I really appreciate the information that you have given. Can you hear me?
Yes, I can hear you fine. Thank you.
Yeah, so having done a thematic synthesis, I know how time-consuming it can be, and it can be kind of, one can be lost in translation when you collect all the information. So I'm just wondering what type of software you would recommend to do this, like the synthesis of the, you mentioned there are a lot, but if you have one in mind, please, can you share it with us?
So I've used 3 different software platforms. One is the EPI Reviewer, EPPI Reviewer, which is produced by the Epicenter in London. I've also used NVivo, which you'll be familiar with for analysing primary qualitative studies. And I've used Atlas TI, all of which you can upload the entire primary study document and analyse it. I found all to be absolutely fine. And there will be others that you can use. I think it's fair to say, though, that the software program doesn't really do any of the analysis. That still goes on in the human brain. What the software product does is help you organize and manage a vast amount of data and send it to you in manageable chunks. You still need to be able to meet with your research group to discuss the data, to see what it means, and to map out and do the mapping and the charting of the data. So I like to do both. I teach students on paper and pen with post-it notes, but then I migrate them onto a software product quite quickly.
Okay, thank you so much.
Great, thank you, Gladys, and thank you, Jane. So, Jane, one of the questions we received is whether there is a specific software to use in conducting meta-ethnography.
With Meta-Ethnography, no, just you can use any software product that I've just mentioned, but there isn't a software product just for Meta-Ethnography.
Okay, great. So we've had a lot of responses on who is using which approach. One question was, do we need to assess the quality of the included studies?
Exactly.
That's a really good question. And again, we could have another webinar on that alone. In a Cochrane context, assessing methodological limitations is a primary marker of a systematic review, and the decision makers will want to know about the methodological limitations of the studies that contribute to findings that might be used in decision making. So in a Cochrane context, assessing methodological limitations is mandatory. Outside of Cochrane, the qualitative community is absolutely divided on the benefit of assessing quality. I think, George Noblet, who developed Meta-Ethnography, says that even, low quality studies can actually have important information in them. I think I take the view that I want to know what the methodological limitations are, because it helps me when I am developing findings. And how that methodological limitation might impact on the credibility of the finding. So in a decision-making context, I think that it's really important. I see that there's another question about using tools. Which tools? So we've just written some guidance on this. It's published in the Journal of Clinical Epidemiology. We don't think there's an ideal tool to assess what we call risk to rigor, which is almost like the opposite of risk of bias in a quantitative, scenario. So we're doing some work at the moment in Cochrane to develop a tool that does look at risk to rigor and moves away from the quality of reporting, because we have good reporting guidelines now. And what we want to move towards is tools that solely look at methodological limitations. And at the moment are the tools that are available, of which there's about 130 of them, to look at a combination of how the qualitative study is reported, and then picks up some of the methodological limitations that might impact on its credibility. So we're doing a lot of work at the moment. So watch this space. At the moment, we recommend CASP, the Critical Appraisal Skills Program tool, but it's not perfect. So we will perhaps produce some more guidance in a year's time when we've done a bit more development work on developing a new tool that's fit for purpose in Cochrane. Any more questions?
Okay, that's great. Well, yeah, we'll have Nivanta Naidu that I think Nivanta would like to ask the question directly. Nivanta, can you hear us? Okay, I think we have some technical problem there. We have Megan. Megan, would you like to ask your question directly?
Hi there, Jane. It's Megan Wainwright. Thanks so much for the session. I have a question. You mentioned that in the implementation domain, these mixed studies review are becoming more common, and I'm working on one at the moment, in which case most of the evidence is qualitative, though there is some quant, and it's a kind of a gray zone, and I wonder what recommendations you have for a mixed studies review that's mostly qual. Should we be looking at the QES guidance over and above any other kind of guidance for effectiveness reviews?
Okay, thanks, Megan, and good to speak with you. And again, we could have done a whole webinar on mixed studies reviews where you include both quantitative and qualitative study types, or mixed method case studies, etc. I think your question is a difficult one, and our view in the qualitative and implementation methods group is that it's helpful to analyze or synthesize data by methodological type to start with. And to analyze it separately and then to integrate it. That's the model. There's a whole separate webinar that we could give on different methods that start off with, that are fully integrated from the beginning, But in a Cochrane context, we would actually say analyze the evidence separately and then integrate it. I've just written a paper as part of the WHO series on mixed method synthesis, which will be out hopefully this year. So I can't answer your question specifically in this short time, but there is more guidance that's coming out. And, you know, I think that we have far fewer examples of the mixed study synthesis, and people are handling it in different ways and using different methods. So I'm sorry that that's a very poor answer, but it's difficult in just doing it in a few seconds. I think I've lost Megan.
Yeah, I think I lost her.
Sorry, I think I was muted. Thanks, Jane. No, that's great. It was helpful to just have clarity on what the position of Cochrane is. Thanks.
Yeah, so there's a clear position in Cochrane. There is the complex intervention chapter probably is a little bit more flexible. So you might want to look at the new handbook when it comes out on the complex intervention chapter. I mean, thinking about more like a framework synthesis, you can map evidence against your program theory, for example, just to see what's going on to start with. Before you get to the level of synthesis. So, you know, getting that overall picture of the evidence, that might be helpful. But what you're saying is that you've got more qualitative evidence. So you're sort of like doing a qualitative synthesis and then seeing if the quantitative findings changes the findings.
Yeah, I mean, we're interested in the quant studies for what they say about process in a way, implementation process. Yeah.
Okay.
Well, this was great. I think I'm not sure if you want to take some more questions, Jane, but from our side, I think we're past our time. Dario?
Well, I'm sure there are lots of questions, there always are, but we're just about out of time. So again, my email address is there if you've got any burning questions. Have a look at the new guidance that's come out in the Journal of Clinical Epidemiology. Hang on a bit longer for the WHO series in BMJ Global Health.
Wonderful. Thank you so much, Jane. This was wonderful. Thank you, Dario, for the support and everyone for joining us today. The recording will be available soon, and join us on our upcoming webinar sessions. Thanks a lot, Jane.
Pleasure. Thank you. Thank you for joining, everyone.